Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Prostate Diseases. Introduction. The prostate is a gland that is found in men. It helps make semen, the fluid that contains sperm. A young man's prostate is about the size of a walnut. It slowly grows larger with age. If the prostate gets too large, it can cause problems. This is common after age 50. The older men get, the more likely they are to have prostate trouble. This program explains a few of the most common diseases that affect the prostate. It also discusses the anatomy of the gland. Anatomy of the prostate. The prostate is one of the male sex glands. It is located just below the bladder, the organ that collects and empties urine. The prostate surrounds the urethra. The urethra is the tube that carries urine from the bladder to the outside of the body. The prostate makes the fluid that makes up most of the semen. Semen is the white fluid in which sperm travel. The prostate is affected by male sex hormones. Hormones are substances that control functions of the body. The most important male hormone is testosterone, which is made by the testicles. The prostate is located in front of the rectum. The rectum is the lower part of the intestine. Prostatitis. Prostatitis is inflammation or swelling of the prostate. There may be an infection in the prostate gland. Prostatitis symptoms vary depending on the cause. They may include problems urinating, burning or pain during urination, pain during ejaculation. Prostatitis may also cause pain in the abdomen, area between the scrotum and rectum, groin, lower back, penis, testicles. Based on your symptoms and laboratory tests, your healthcare provider may diagnose one of the following types of prostatitis: acute bacterial prostatitis, chronic bacterial prostatitis, chronic abacterial prostatitis. Acute bacterial prostatitis is an infection of the prostate by bacteria. It may cause flu-like symptoms associated with the sudden onset of infection. These symptoms may include chills, fever, nausea, vomiting. Chronic bacterial prostatitis is bacterial prostatitis that lasts for at least 3 months. This can happen if the infection is recurring or it is hard to treat. Bacterial prostatitis may not cause symptoms or may cause minor symptoms that become severe when the infection flares up. Another type of chronic prostatitis is not caused by bacteria. This condition is known as chronic abacterial prostatitis or chronic pelvic pain syndrome. It lasts for at least 3 months. This is the most common type of prostatitis. Symptoms may come and go or stay the same over time. Symptoms sometimes improve over time without treatment. Asymptomatic inflammatory prostatitis means that the man does have prostatitis, but there are no symptoms. It's often found during other tests and doesn't need to be treated. Risk factors for prostatitis include being young or middle-aged, trauma to the pelvis from an injury, using a urinary catheter, which is a tube that drains urine. Other risk factors for prostatitis are having a bladder infection, a prostate biopsy, HIV/AIDS. Antibiotics are a commonly prescribed treatment for prostatitis caused by bacteria. The specific antibiotic depends on the type of bacteria present. Treatment for chronic abacterial prostatitis focuses on relieving symptoms. Muscle relaxers or pain relievers may be recommended. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Benign prostatic hyperplasia. A man's prostate gland usually gets bigger over his lifetime. Many men have problems associated with an enlarged prostate as they age. This condition is called Benign Prostatic Hyperplasia, or BPH. BPH is normal and may result from hormonal changes. Many men with an enlarged prostate have no symptoms. Some men have minor symptoms. About 1/3 of men over 60 have moderate to severe symptoms. Symptoms tend to get worse over time, but sometimes the symptoms stop getting worse or even get better over time. Symptoms of BPH include a feeling of not fully being able to empty the bladder, a weak urine stream, blood in the urine, difficulty starting urination, dribbling or leaking urine, more frequent urination, and a strong, sudden need to urinate. Your healthcare provider can diagnose BPH by asking questions about your symptoms and past health. A physical exam will also be performed. Tests may include a blood test, digital rectal exam, urine test. Many men don't need treatment. Complications of BPH include backed up urine, bladder infections, or bladder stones. If you have symptoms or complications that bother you, talk with your healthcare provider. Men with symptoms that bother them can practice double voiding. This is when you urinate twice. Urinate completely once, then rest for a moment, and urinate again. Caffeine and alcohol can make your symptoms worse. Men with BPH should also not take medications that make it harder to urinate. These include over-the-counter decongestants and antihistamines. Medications can lessen symptoms, but medications do not remove all of the symptoms. Not taking the medication can make symptoms come back. Your healthcare provider may suggest a procedure to treat BPH or, in severe cases, surgery to remove part of your prostate. Prostate cancer. Prostate cancer is one of the most common forms of cancer that affect men. The earlier prostate cancer is detected, the better the chances for its successful management. The body is made of small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor. A benign tumor is a non-cancerous growth. They are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the prostate will always be called prostate cancer, even if it spreads to other places. Early prostate cancer usually has no symptoms. The first sign of prostate cancer is usually difficulty urinating. Treatment of prostate cancer depends on the type of prostate cancer and its stage. People with prostate cancer may have active surveillance or watchful waiting, surgery, hormone therapy, radiation therapy, immunotherapy, chemotherapy, cryotherapy. A combination of these treatments may also be used. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. The prostate is a gland that is found in men. It helps make semen, the fluid that contains sperm. The prostate is affected by male sex hormones. Hormones are substances that control functions of the body. The most important male hormone is testosterone, which is made by the testicles. Prostatitis is inflammation of the prostate. This means there is swelling and possibly an infection in the prostate gland. Symptoms vary depending on the cause. They may include problems urinating, burning or pain during urination, pain during ejaculation. Symptoms of prostatitis may come and go or stay the same over time. Symptoms sometimes improve over time without treatment. A man's prostate gland usually gets bigger over his lifetime. Many men have problems associated with an enlarged prostate as they age. The condition is called benign prostatic hyperplasia, or BPH. BPH is normal and may result from hormonal changes. Symptoms of BPH include a feeling of not fully being able to empty the bladder, a weak urine stream, blood in the urine, difficulty starting urination, dribbling or leaking urine, more frequent urination, and a strong, sudden need to urinate. Prostate cancer is one of the most common forms of cancer that affect men. The earlier prostate cancer is detected, the better the chances for its successful management. Thank you for using Explain.